So today is focused on the residents learning how to do cataract surgery in a wet lab, in a setting where they can practice how to do surgery. And that is so critical to our overall education mission and curriculum, because it's important for the residents to learn how to do surgery before they step into the operating room, before they have the pressure of taking care of patients and doing surgery.
We're learning how to do different surgical techniques, getting used to the operating room itself. It's just such a fun time because we have the whole residency program here, a bunch of very mature yet very goofy young men and women just kind of learning how to be surgeons in ophthalmology. So it's a really fun environment and we're just having a blast and all learning at the same time. So this prep course that we have it every year on Saturday morning, and it's absolutely essential to our success. We have a variety of courses and it's always geared to the skill set of the residency class. So as a first year, a lot of what we were working on was figuring out what the OR looked like and how to put on gloves and how to gown ourselves without contaminating everything. But this year, when we sit in front of these artificial eyes and we're using the phaco machine and we're actually able to have that feeling of doing real surgery, it's so much more meaningful, especially when you already have a few cases under your belt.
The residents help to create, we have backup on call, and they help to create this sense that there's no intrusion. No matter what they're doing, they're able to come in, they're able to see patients with us, they're able to make the situation comfortable for us. There's no sense that I'm bothering someone, that I'm intruding on someone's time, because they're there to help us learn, and they make that very apparent from day one when we start here.
Nobody ever makes you feel like you should know something, that you're incompetent for not knowing something. Everybody's always supporting you, trying to lead you to your success. And so we use these simulation eyeballs. We go from beginning to end of a phacoemulsification cataract surgery. So actually getting to do the hands-on part of this is so different than even what you can read about or watch in a video. So having a workshop like this where you're able to do everything on your own and get comfortable before you actually start doing it with patients, it's one of these symbolic moments of transitioning from being an intern to becoming a resident when you're going to be the one that's actually doing these procedures with patients.